Hi, I'm Bobby Kimbrough, and welcome once again to Off the Cuffs. We're here today with Mr. Swift, the Public Health Director for Forsyth County. I'm excited about this conversation. My mind is racing. There's so many questions I have to ask you. But before I just dive right in and start bombarding you with questions, tell us about yourself. Tell us who you are, and how did you arrive in Forsyth County?
Well, just a quick history. I grew up in Surrey County.
Okay.
I was born at Baptist Hospital, but I grew up, like I said, in Surrey County, just up the road between Elkin and Dobson. And a little over 12 years ago, I became a health director. 11 years ago, became health director in Stokes County. So I was there for about 2 years and moved to Wilmington, where I was deputy health director. Came back 6 years later, about 2 years ago, to be a health director in Caldwell County, and started here last November. So I've been here a year.
So you and I have talked previously many occasions. I was amazed at your story and how you arrived here. You told me you graduated from App State?
Yes, sir.
App State, yeah. And you told me about some bumps and how you figured it out and got it back together. When we first talked, I was amazed by that, how your perseverance, staying the course, not giving up, going to get what you wanted in life. And so when I was thinking about guests for the podcast, and I was thinking about you, and you and I have had some conversations, I said, I want him, because we want to address issues here on this podcast where we'll address elephants in the room. We'll address things that can help one another, how we can grow the community, how we can better understand one another. So as the Public Health Director for Forsyth County, what is it that you do? I mean, what's your function here in the county?
Well, I mean, general statutes, North Carolina general statutes require that every county have a public health director. So there's 100 counties. There's actually 86 health departments across the state. Some are districts where you have more than one county under a health department. So we're in the statutes. The local health director is part of the county and is to be the administrator and to oversee the functions of the public health department. Wow. And we do, lots of stuff that a lot of people don't realize. I mean, yes, we have clinics, such as our WIC clinic for women, infants, and children, where we work with moms that are pregnant and their young children. We work with immunizations. You think about hepatitis A, B, C, sexually transmitted diseases.
Wow.
But a lot of people don't realize that we inspect every restaurant in the community. We do all the public swimming pools. We do tattoo artists. We do all the wells and septic systems. So it's a lot that goes on in a lot of places that we touch.
So basically, you're concerned with the health issues of the county.
Yes.
So you're the Public Health Director for the fourth largest county in the state of North Carolina.
Yes, sir.
That's a huge task. So how long have you been in this position?
I've been here just a year and a few weeks.
So if you had to just give us a report, what are some of the issues that you see in the community, health issues? First of all, do we have any health issues?
Yes, we do, and that's every county has health issues. I mean, we have chronic issues with chronic diseases such as diabetes, obesity. Those are some of the big ones that are affected by our lifestyle and how we treat our bodies and what we put into our bodies. But we also have some issues with just, a lot of people don't realize, and I believe we talked about this before one time, how there's your genetic code. Right. And for years, that's what we talked about, how that affected our health. It was kind of like you were born this way or that way.
Right.
And, you're either predisposed to diabetes or you're predisposed to high cholesterol. And that is true. But a lot of it's the environment that you grow up in and those stresses, like toxic stress that you're exposed to. Whether you grew up in poverty, whether you grew up with access to healthy foods, the crime in the neighborhood. So a lot of those things, your zip code has as much influence on your health as your genetic code. And that's things that we're finding out now. And I think we have a lot of disparities, like a lot of larger counties, but we have them in Forsyth County.
So I heard you say that you had worked in previous counties prior to coming here. Are there some issues that are just specific to this county that you have seen from working in previous counties?
Well, I think of the counties that I mentioned, I've worked, and I've worked in some other counties. I worked in Wilkes County and in Iredell County in health education and health promotion out into the community, working with community members. I think the biggest similarity, because of our size, the fourth largest county, is when I worked in New Hanover County, which is Wilmington. It was a larger county. not as large as Winston-Salem, but still quite large. And just the disparities between individual groups and as far as poverty and how that affects the health of individuals. So
explain that. A lot of people, I get it, but some people may not understand that. How does that affect the health? Poverty, and you touched on it briefly, how it affects public health or how it affects environmental codes. I know you talked about our DNA codes. Mm-hmm. Explain that.
Well, I think the big, obviously most obvious you would say is, well, do you have access to health insurance? Mm-hmm. And if you're in poverty, you may qualify for Medicaid. You may be old enough to qualify for Medicare, or you may be the working poor, which doesn't have access, or they're not eligible for health insurance through their employer. So you have that. But then also you just have those stressors that come with living in poverty that affect your health. They did some studies on the infant mortality.
Okay.
You talked about, that's a huge issue in Forsyth County. And that is one I would say that I haven't seen as much, the disparity between African Americans and whites as far as the death rate for infant mortality. So
why is that, you think?
Well, I think a lot of that is because of those social factors. They've done studies where they looked at the infant mortality rate in the military. Mm-hmm. So in the military, you have the same health care options.
Right.
And it was still a higher rate among African Americans. And a lot of that, they believe, and they've done studies to show it, is because of that toxic stress that builds up over your lifetime. And I think we're seeing...
so when you say toxic stress, what do you mean?
Well, I think that stress that just adds up, whether it's microaggressions that people are faced with, whether it's just the stress of being in poverty, the stress of maybe violence in your neighborhood, not enough access to healthy food, and just... So there's a lot of those things that I think that chip away and over the course of your lifetime that lead to that poor health outcomes.
So I keep hearing a number floating around in the county and throughout conversations. So I first heard this number. I was having a conversation with police chief. I heard it by an elected official. I heard it by a candidate. And I just got to ask you, because you would be the guy that would know. So I heard this number of 13.9 or 14.9 life expectancy less than based on an area code or zip code that you're living in. Explain that to me. Is it area code, zip code? Explain that. Is it factual or what is this?
Well, it's true. I mean, we've looked at the zip code data, and we've looked
in this county.
In this county. So we got the information from the State Center for Health Statistics, and they've showed us the data, and we've mapped it out by zip code, and you can see that in areas, and it's the 27101, 27105, primarily in the East Winston area, that the life expectancy is pretty much 14 to 15 years less than the far extremes of the county, Louisville, Kernersville, Clemens, those areas.
Why is that? To me, that's just mind-blowing, appalling that in one part of a county, there's a 15-year life expectancy less than someone living somewhere else. Tell me why is that? Explain that to me.
Well, I mean, I believe, and the research shows that a lot of it is, I mean, these social determinants of health: housing, food, jobs, transportation, violence, and we see that there's more poverty and more violence in those areas where there's the lowest life expectancy. You have, just think about if you're looking at the numbers, if you have more infant mortality.
Okay.
So young babies dying before age 1. And then if you have violence where maybe young men or women are dying at an early age, so that's automatically, just those two are going to take your life expectancy down.
When I hear that, it bothers me for several reasons, because I'm a product of East Winston, 405 East 25th Street. It's where I was raised up at. It bothers me when I hear that number, because I still have family members and people that live in that area code. And more importantly, it bothers me that a fact or a statistic exists like that. And I'm sure that it has been existing for quite some time. I'm sure that it has been known for quite some time. So my question is, now that we know this, what is being done to curtail those numbers, to stop that? Because if you think about it, 15 years life expectancy of less than someone else, that's a generation.
Well, I mean, you're right. I mean, that's 15 years is a long time.
Oh, definitely.
I mean, I have an 8-year-old and a 12-year-old, and they never saw their grandmother, who died 12 years ago, right before my daughter was born.
Right.
And she had poor health outcomes from diabetes and high blood pressure. I believe, what we can do. One, if I had to put in one sentence my theme or goal, battle cry, whatever you call it,
Right.
for public health in this county is that we're going to get better health through better partnerships. So, we got to build partnerships. We got to build bridges.
Partnerships with who?
Well, I think we got to focus on the community, whether it's the faith leaders, really those, I call them natural champions in the community. Maybe they're not an elected official,
Mm-hmm.
and maybe they're not a director. They don't have to be a director of an agency, but finding those natural champions in the community. That's what we're trying to do now, trying to find individuals that can help us. And my goal is not, I don't believe that the public health department should go into a community and say, well, we're here to fix your problems. I think we should try to empower the residents in the community to try to focus on what they're doing well and build up the community, empower them.
So here's what I believe, and I could be wrong because I don't have the expertise you have in that area. But just from my limited understanding is that information like that is powerful. That's an information that should be in the community. We should have, as you say, champions in the community having roundtable group community discussions about that. This shouldn't be something that's in a book somewhere. This should be something that should be public enemy number one in that area. How do we fix that? Because when I look at it, and I look at it from a perspective of security or safety, that's a problem because, on this show I've said it many times, Maslow talked about this thing of the hierarchy of needs, and he talked about food, clothing, and shelter, all those things that you're speaking about, that the stressors that causes that, whether it's access to the system, education, whether it's food, and all those things that we talk about. This had to have been known prior to now. So my question becomes, what are we going to do about it? In other words, it's a social issue. It's a public health issue. You say we've got to build better partnerships. So who do we need to build these partnerships with? Because we're late to the party. We're late to the dance. And by being late, that means that we're burying more people because of our lack of partnership, because of our willingness or lack of willingness to act. Something has to call us to action to start moving now, because the area in which you're speaking about, I still go to that area for a lot of reasons, whether it's to the barbershop, whether it's to visit my sister-in-law, whether it's to visit friends and families, or if it's nothing but to drive through there and park my car and reminisce from which I've come from. And so to have that knowledge and see that in my mind and see the young kids playing in the streets, playing in the schools, playing in the recreation department, and know that they have a less life expectancy than someone else a mile away from them is frightening to me. And I think that we've got to address that, and we've got to start to move on that now. So tell me, what do you need from the public? What do you need from us? Because I'm challenging you to champion this cause, to make a difference. We started this podcast. Our purpose was to put information into the community. Our purpose was to empower people through knowledge. That which you have given today is very powerful, because now we know what the diagnosis is, we know what the information is. Now we got to go about changing it. And so what do you need, and what do we need to do to change that narrative?
Well, I believe, one, we got to raise awareness.
How do we do that?
I think we got to educate the public about this issue and what can we do about this, and try to look at, it's really it can be overwhelming.
Very.
And I think we're going to have to take this a little bit at a time and focus on small improvements in the community. Again, I think we got to focus on trying to build capacity in areas that have been neglected in the past. So we got to focus on that. I think it's going to take the whole community getting around this. It's not just the health department and our 250 plus staff.
Mm-hmm.
It's going to take more than us. It's going to take more than just DSS. It's going to take more than the sheriff's department. It's going to take the hospital systems. It's going to take community leaders. It's going to take, like I said, those natural champions at the grassroots level. I think it's going to take, about partnerships. It's going to take the private enterprise to help out. I think.
I guess that goes back to one of the things that we talk about all the time. It's an all hands on deck issue. It's an issue that is not going to take just one part of the county. It's going to take all parts of the county to address this. It's going to take many of the systems that we have to address this issue, because it's obvious that it needs to be addressed, and we've got to move on it. Excuse me. So, wow, that's amazing. Mm-hmm. So give me another issue that you mentioned a few that we need to address in the community, in the county, whether it's infant mortality, whether it's a lot of public health issues, sexually transmitted disease, whatever it is, because I think that people are searching for true knowledge. People are searching for knowledge that will empower them and hopefully encourage them to go out and be a champion, one of those champions in the community, whether it's going out trying to make a difference, putting sweat equity into the community to bring about a change. Because there are a lot of people sitting at home wondering, what do I need to do? What is my call to action? What do I need to do to make a difference? One of the things that was very empowering to me is that, everybody in life has one of those yaha moments, I guess, that roll to the Mathis moment, where you realize, what am I doing and what can I do? Mine was in 2005, and I may have shared this with you in our conversation previously, is that when I looked at my life and I started asking the question, how do I live between the hyphen? How do I live between my birth date and my exit date? How can I be a better person? How can I affect change, and how can I affect lives? Because, you come to a point in life where I've said on many occasions is that at my age, at 58, I won't see 116. Nor do I want to see 116. I don't want to be a burden on anyone. But then I started asking myself, the question is, at what point do you start living for someone else? At what point do you start living to make a difference, to leave that indelible footprint? At what point do you try to make a difference in society and you become significant, you become relevant to where you start to make changes in not just your life, but in people that surround you, the communities, the towns and the cities in which you come from? And that is how I have chosen to live my life, making a difference, because we've got to make the difference. We can't sit in the arena and be spectators anymore. We've got to come down where the gladiators are, where it's taking place, because when you talk about numbers like that and you talk about the issues, these are issues, public health issues. These are not issues where somebody is hiding. These are facts. These are numbers, information that we know. And I think that now that we know that, now that we have heard it from an authority, we need to get serious about the business of, what do we need to do? What is our call to action? How do we do this? And so I appreciate you just having the courage to be transparent. I love that. I think that's one of the things that drew me towards you, is that you're a truth teller. And that's what we need. We need a lot of truth tellers in order to address the issues.
Mm-hmm. Well, I think you're right on. I think we got to tell the truth, and then we got to roll up our sleeves and get to work.
I like that.
And I think, my goal, I'm 42, so I'm about 14 years into my public health career.
Wow.
And so I have more of my public health career ahead of me than behind me.
Exactly.
And this is one of my goal is we got to focus on life expectancy. And people have come to me that I've told this to, a few people, and said, well, how can you do that? Because You're just the health department. You're just, the health. You're just. I mean, you can't curb violence, or you can't end poverty, or you can't increase access to healthy foods. But I said, well, maybe I can get someone to the table and get people to start this conversation to where we can try to build those partnerships, connect the dots where we can make the difference. And it might not be in the next 10 months. It might take 10 years. It might take 40 or 50 years. It may be long after I'm gone. But trying to get there, start having those tough conversations, and start trying to, you're rolling the boulder up the hill.
Right.
It takes a while to get it moving. And, now it's been rolling downhill. We're trying to push it up the hill over the crest of the hill. So I think it's going to take time. You ask about, other health issues in the community. And I think one, obviously, with the life expectancy, that's obviously the end of life. But then you look at the beginning of life at infant mortality, how that is affected. And it's, again, our African-American and Hispanics have a higher infant mortality rate. The last year, in 2017, is I think the last year we have data, it was probably 18 the deaths per 1,000 versus 4 or 5 for white. So just drastically higher rate. And, we're trying to change that paradigm. We're trying to get information out to the public, working with the hospitals, trying, safe sleep, making sure babies are sleeping safely in cribs and not co-sleeping in the same bed with mom and dad.
Right.
And so we're trying to change that, and that's an uphill battle too, because there's a lot of norms, or people say, well, my baby slept like that, or the grandma or
Right.
the grandpa or our family members. Like, well, no, this is what we know, and this is the science, and this is the safest thing to do. So we're trying to fight that. We got an infant mortality reduction coalition that's focused on that. We received some grant funding to buy those safe cribs for babies. It's called a pack and play, or the thing you fold out. So we're trying to do that. But again, like I said, it's going to take any of this for it to be sustainable. It's going to take the whole community. And I've talked with you before.
Yeah.
I'm like I said, I grew up on a dirt road. So, I believe, we got to take it, one step at a time, simple. I was blessed to be able to go to college, go to Appalachian State, and then got my graduate degree, Master's in Public Health from South Carolina.
Yeah, I remember that.
So, I think there's, like I said, it's an uphill battle.
Well, I appreciate you. I almost feel kind of self-conscious drinking my favorite soda while you sitting there drinking water, right? And I got the public health director here, but I guess, I'm going to keep drinking.
That's okay.
But anyway, you said something that was interesting to me, and I want you to know this. You said that someone said to you, you're just the health. No one is just anything, whether they're just a custodian, whether they're just a person. Everyone has a voice. Everyone has the ability to bring about change. Everyone has the ability to be used for the greater good. Because just as you said, you having the information, you sharing the information, you bringing people to the table to bring attention to it starts the conversation, which starts the movement, which starts the chain reaction, which starts a whole new direction for us to move in. So no one is just nothing, because you do have a tall order in front of you as the public health director for the 4th largest county in the state of North Carolina. I applaud you for being here. I applaud you for what you're doing. It's just that I think that a lot of issues that are happening, we could all trace back to some form of public health. We could. Public health, whether it's safety, it's a public health. Whether it's, as you said, issues as it relates to food, access to medical care, access to proper food, or access to a better diet. So all of that is a factor. All of that comes to play in public health. And so anything that I can do, anything that we can do to champion the cause or keep it moving, please count us in, because there's so much happening in this city and in this county, is that my focus is to try to bring about the realization that we all in this together.
Yes, definitely.
And the analogy you gave, rolling up our sleeves, all of us are going to have to roll up our sleeves. All of us, regardless of what affiliations, regardless of race, color. It does not matter, because at the end of the day, we're in this together. Because eventually what, as the great Martin said, what directly affects one will eventually indirectly affect all of us. Mm-hmm. And the issues that we're having inside certain areas of the county will eventually impact all of us. And so I applaud you for what you're doing. You're welcome back here anytime. And what I like to do before we sum it up and close it up is that anything you want to share with us, anything that you can think of that may help us in trying to be better stewards or consumers of what we put in our bodies, because, I guess the side of you that you feed the most is the side of you that becomes dominant.
Yes. Well, I would say one, I see the blue line, and I know that this is for represents law enforcement. Uh-huh. It's a beautiful table we were talking about before we went on. But one thing, it makes me think of a stream.
Mm-hmm.
And
it
was Desmond Tutu. I forget the exact quote, but he talked about how basically we're pulling people out of the stream, downstream. We're pulling people out, but we got to think about why are they going. We got to think upstream and like what's causing them to fall into the stream, and that's where when I'm looking at these health issues.
Good analogy.
We got to think upstream. I mean, we still got to roll up our sleeves and we got to work. We can't get that paralysis of analysis where we're just going to think and plan for decades. I mean, we got to get to work. And I do believe we got to do small things to make a difference. Well, I mean, some of the small things are, like I said, one, just getting people to the table, starting the conversation. Two, encouraging people to, be more active, trying to get healthier foods into areas. Yes, I can't make Harris Teeter or Publix, move into a certain area, but maybe we can take a model that they had started in Wilmington before I left, where they had these mobile farmers markets.
When you say
they moved into the areas.
When you say better food, explain that. So you saying like having access to food, or a particular food is a better quality than the other? What do you mean when you say that?
Well, I'm not a nutritionist, but I mean I've studied this enough to know that one, just access to healthy food, fruits and vegetables, in the community.
I got you.
Usually what happens in most communities that are impoverished, no matter where it is, there's, you usually just have convenience stores, and there's not the fruits and vegetables that are there, and they're so expensive. Mm-hmm. So one, just getting access to the healthy foods. Then you got to have, thinking upstream, making sure that people know how to cook them in a healthy way that tastes good. Then thinking more upstream, do they have time? Is mom working 2 or 3 jobs? So she doesn't have the time or maybe the money to afford to buy the food or the time to cook the food and things like that. I mean, we used to talk about when I first started, like I can talk and say, hey, your kids need to be more active. They need to get outside and play. Well, if they're concerned about their safety, whether it's because they're near a highway with traffic or there's violence,
right.
or
can't do that.
Yeah, you can't do that. So trying to think, beyond just the obvious. I mean, trying to think upstream again, going back to that thinking upstream.
I like that.
So I think it's going to take that for all of us, is changing our mindset.
Well, what I would tell you as we continue to think upstream, here's what I'm going to commit to, is that if you champion the cause, I'll join you at the table. I'll bring my sweat equity and what little bit I know, what little bit I have, and we'll try to change this narrative, because it's one that we've got to do something. Because we wouldn't be good stewards of what I call good stewards of the public's trust, good stewards of the people who have placed us here to do what is right, to have information and especially negative information, and not try to turn that negative to a positive. If we don't take the model of Desmond and try to go upstream and change some lives. To me, we wouldn't be good stewards as human beings in trying to do what is right for all of mankind. So, as I said, if you set the table, champion the cause, I'll join you there and bring everything I have to try to do that, because there are a lot of things that concern me, as you talked about, whether it's safety, whether it's food, whether it's education, whether it's the life expectancy. All these things are relevant. All of these things actually coexist together, and we can change that narrative. We can. We have the ability in this county to do amazing things. We have wonderful people. It's probably one of, not if probably, the greatest county on the planet as far as I'm concerned. I love this county. I'm a product of this county, born and raised here, and it is my county. You know, I say that openly, my county, meaning I was born here. Matter of fact, when they lay me to rest, they'll lay me to rest in this county. So I appreciate you being here. Anytime you want to stop by, you don't need an appointment. Just call us, and we're going to stop and come running. As always, thank you for stopping by and joining us at Off the Cuffs. I appreciate you, Mr. Swift.
Appreciate you.
Appreciate you, my brother.